Okay, let's go ahead and get started. So today, we know that it's been a long year and it's been a long couple of weeks since we have been fighting since we last left each other when we left with a call to action to please engage your communities, to also engage our senators and our Congress members, members of Congress about the budget reconciliation bill, the mega bill that passed. We know that that is hard. We are devastated as well, but we are not losing hope and we are not losing energy. So today we wanted to come back and share with you what we know. But before we get started, let me cover a few housekeeping items. First, yes, this presentation or this conversation today will be recorded. The recording and the slides will be emailed to registrants more than likely tomorrow by the end of the day. We're going to hear from our colleagues today in the call, but we're also going to leave rooms for questions and answers for Q&A. You can provide your questions that you have at the bottom of the screen. There is a Q&A link that you click on that link and drop your question, and we'll be happy to add that to our queue. And that being said, let's go ahead and get started. Next slide, please. So today we're here to provide as much information as we have to date about the impact of the mega bill that was passed. Keep in mind, I'm not calling it the big beautiful bill because it is nothing beautiful about it. But I want to just speak very calmly and dispassionately about the facts that this will be hard on the Tennessee community. We are being joined today by Jane Dinwabi and also Signe Anderson. Jane is going to help us understand what we know about the timeline for the impacts of the policy changes of the mega bill. And Signe is going to do the same, but she's able to provide a little bit more information, detailed information about what's happening now with regards to the changes with regards to SNAP and nutrition assistance here in Tennessee. So I am going to call Jane up. Jane, when you are ready to come off camera, um, I will make space for you. One more thing, go back to that previous slide, Reed, if you can. While Jane's coming up. Okay, just so you know, the Tennessee Justice Center is a nonprofit tax exempt organization. We are not partisan. The only individuals that we champion are those that are residents of Tennessee that could benefit from understanding about access to healthcare and access to nutritional services. We do our due diligence by providing factual information about policy analysis, also sharing the information that we know. We also learn a lot about the implications of Medicaid and SNAP policy because we have clients that call the Tennessee Justice Center to ask for help navigating that administrative process. So I just wanted to make sure that we had that disclaimer. Okay, Jane, you are up. I will let you jump in.
Um, I will kick it off by just thanking everyone for being here. We've been talking about the threats of this bill for, close to 5 months now, consistently every week. And now we have some information about, like Tanae said, some of the unfortunate impacts. I'll be covering the health portion, and today I'll just be reviewing the provisions that were in the final bill that was signed into law on July 4th. We'll run through the provisions and their effective dates in the next just under 10 minutes, but I just want to emphasize that a lot of these provisions are complicated. They will look different in different states, and so this is an overview to get everyone up to speed and not necessarily dictating what you can expect to see in the near future. So starting off at the top, now that this bill is signed into law, we're looking at Medicaid and SNAP cuts that are predicted to result in the loss of health insurance for 17 million people nationwide and about 5.3 million families on the SNAP program. So this is based on estimates from nonpartisan Center for Congressional Budget Office that is really on the ball in taking these provisions and churning out numbers as to how they'll impact people across states. We'll get updated numbers in the next few months, but this is what we have now. Next slide, please. So the Medicaid program will be cut by $1 trillion. That's the number that we saw when the bill got back to the House, and that is the number that was agreed on. So that's the federal funds that we can expect to lose over the next 10 years. We talked about this a little bit earlier, but the span of the 10 years is significant because we might see different changes in different years, and again, different changes on two state budgets. We know that the trillion in federal cuts will actually drive 300 billion loss of state funding, so various states. So the overall impact is 1.3 trillion dollars. Again, the breakdown of the CBO estimate of 17 million is a staggering number. It's hard to wrap our minds around, but essentially the health infrastructure as we know it will look different in the coming years. So again, remains to be seen what that looks like here in Tennessee, but we're looking at millions of people losing health insurance through Medicaid as the program proper, but also through the Affordable Care Act, which you'll hear reference to as Marketplace. By and large, the worst parts of the bill, the most harmful parts of the bill are to Medicaid expansion states. So these are states that expanded the Medicaid program to cover people who were who were beyond a very strict income limit. So they're still low income, but they're not low income enough to qualify for Medicaid. But in states like Tennessee, where there are people who are on the marketplace, the program is going to become marketplace is going to become unaffordable or inaccessible for them as well. So even though Tennessee didn't expand its Medicaid program, there are still people in our state that are on the marketplace that will be impacted by some of the worst parts of this bill. And then just overall, the program is going to become less efficient. There's going to be a lot more red tape that prevents people from enrolling or makes it difficult for them to stay enrolled. So those are kind of the overview. So let's talk a little bit about some of the main provisions and their effective dates. So one of the things that we've been beating the drum about for the last few months is nursing homes. Nursing homes, over 60% of people in nursing homes are on Medicaid. Medicaid is a huge payer of nursing home care for older people. And here in Tennessee, that's no different. But nursing homes, there are also consistently nursing homes that have low staffing and overall low quality of care for the people who are residents of those nursing homes. So in 2024, the previous administration, the Biden administration, implemented a nursing home staffing rule that actually established a minimum quality of care through staffing for nursing homes across the country. It was a very hard fought win, and it was supposed to be one way to ensure that quality of care in nursing homes remain high. This bill repeals that immediately. So for the next, continuing until 2034, there will be no implementation of the nursing home staffing rule, which means that there's no minimum staffing level and quality of care for nursing homes. Provider taxes are a huge way that states pay for the Medicaid program. So a state is able to tax providers, which are essentially hospitals and other care centers, and use that money to pay for the Medicaid program. This bill limits the state's ability to collect provider taxes, and it's effective immediately and will continue. But states have about 3 years to transition their funding program, but essentially it's effective immediately. So we can expect some pretty concerning changes to the state Medicaid budget. It stops the implementation of the eligibility and enrollment final rule. This for what you need to know about this is Medicaid is a complicated program for many people. That's kind of why, like Tanae was saying, TGC is here. We help people navigate the program consistently because they face challenges in enrolling and staying enrolled. The eligibility and enrollment final rule was one way that CMS had prepared or planned to reduce barriers, prepared ways to reduce barriers for people to stay enrolled in the program. This bill stops implementation of that immediately and until October 2034. So we can expect more challenges, more red tape, and more issues for people who are enrolled. Significantly, it also changes the category of immigrants that qualify for Medicaid or CHIP, which is Cover Kids in Tennessee. Contrary to popular belief, undocumented people do not qualify for the Medicaid program, and there have been very, very limited enrollment options for people who are refugees or asylees or trafficking victims. This now changes that. So the only immigrants that qualify for Medicaid are essentially LPRs or people who are long-term residents who undergo a 5-year bar and some Cuban and Haitian entrants. So refugees, asylees, and trafficking victims no longer qualify, and that's effective October 2026. Next slide. And then some others that I can run through pretty quickly. The retroactive coverage policy is a way where there are folks who are eligible for Medicaid, but they don't know it. And so if they apply for Medicaid under certain circumstances, they can actually get their Medicaid coverage dating back 3 months. At least that was the old rule. So imagine you get, this happens where people end up in the hospital and they can't quite figure out their Medicaid application until maybe a few weeks into their stay. If they apply a few weeks into their stay, it actually goes back to cover the length of their stay so that they're not being saddled with bills when they were actually eligible for Medicaid. Well, that period was 3 months and now it's 2 months, and that's effective in January of 2027. And then another one I want to mention is home and community-based services. So right now, states are able to apply for waivers to the federal government to offer home and community-based services for people with disabilities. And this just expands how states can approach submitting those waivers and just kind of add some restrictions as to how new waivers have to be balanced with existing waivers. Next slide, please. And finally, the bill establishes a rural health funding program that provides $50 billion in grants to states for the next couple of years. This is significant because, as a lot of media has reported, and we have reported as well, the one of the most impacted areas will be rural communities because rural hospitals significantly depend on Medicaid. So this fund is meant to kind of soften the damage, the projected damage, and we can kind of expect the funding will be shared across all states. So there's no details about what Tennessee's will look like, but we can expect that funding to be dispersed, or at least begun to be dispersed in the beginning of the fiscal year 2026. So that's later this October. So just so you all are aware, these are the enrollment numbers we've been reporting. They're unchanged. We're looking at hundreds of thousands of folks in Tennessee losing access to healthcare, and we're seeing Tennessee facing almost $10 billion in it, a $10 billion increase in its state Medicaid budget. Next slide. And just to reiterate something that we've been talking about for a while, Tennesseans really rely on Medicaid to the tune of 1.4 million people relying on the program currently. And we know across demographics, whether folks are in rural areas, whether they're in urban areas, whether they're pregnant or have a disability, veterans or in nursing homes, they significantly rely on the program. So we can kind of expect a variety of impacts across our communities. And that's all I have for Medicaid.
Thank you, Jane. So I'm seeing questions come through. There were questions that were also submitted in advance of the call during the registration process. Some of the questions we'll be able to answer today, but some of the questions, we are all in the same bucket in this country. We are taking this information and dissecting it to see how all of the policy changes will impact our state. So we're working with our national partners. We also have a small but mighty team here led by Jane, who's crunching the numbers for Tennessee. But keep lifting up your questions because that's going to be helpful for us to make sure that we're not missing any buckets of information to try to research. And also, this is going to be really helpful as we start to engage our state legislators in advance of next session and also continue to hold our senators and members of Congress accountable. Speaking of holding accountable our members of Congress and our senators, we next have Signe Anderson, who's up, who does a wonderful job of that day in and day out as the senior director of nutrition advocacy. Signe, I am turning it over to you.
Thanks, Tanae, and thanks again, everyone, for being here today with us. As Tanae mentioned at the top of the call, this has been a lot. And I just want to, again, express my thanks to all of you for sticking through this and continuing to learn about what's happening and acting on it. And I will say the bill has passed, but this is not over. There is so much more work to be done now that we're on the other side of it. So stick with us and we'll help in all the ways that we can. For the SNAP side, these are the most severe cuts to SNAP that we've seen, as I've mentioned in past calls. There's a lot more work to be done as far as understanding what the rules are now that we're coming out of this. We need to know how to communicate the changes for organizations like ours. So several of you who are in our position where you're serving clients, we're here to give information about how the programs will change and how do we communicate these changes to the people that we serve. But the other piece, the piece that where the work continues, is we really need to demonstrate the problems with these changes so that we can advocate for removing them and making the program better in the long run. And then also to what Tanae said, and we'll continue to repeat this throughout the call, but we have to continue to communicate and continue to talk to our legislators about what the impacts are with this. And we will continue to work with you all on this as far as making sure that those who voted for the bill are held accountable and make sure that they know what the cost is for moving forward with that. So on that piece, on this first slide here, with the bill passing, that means $186 billion in cuts from the SNAP program. The direct and negative effects that we will see to Tennesseans will particularly impact seniors ages 55 to 64, families with children ages 14 to 18, veterans will be impacted, houseless individuals, and children aging out of foster care. All SNAP recipients, also our immigrant neighbors will also be impacted. And I will dig into the details on the next couple of slides and also give you a bit of a timeline. So here's some of the final breakdown with the SNAP bill on the policy change side. We've talked extensively about the work requirements as we've led up to the passage of this bill. The bill extends the work requirements for people through the age of 64. These are one of those changes that in the bill it says effective immediately, but that means while it's effective immediately, there's no specified date, but we are waiting on implementation guidance from USDA and from the state. So as soon as that guidance comes through, we will keep you posted, but these are some of the immediate changes that we can expect before the end of the year. The bill also extends work requirements to parents of children. SNAP has always had work requirements. but it's never been placed upon families with children. Now it does. So parents who have children ages 14 to 18 will now need to adhere to those work requirements, as will veterans, unhoused individuals, former foster care youth up to age 24. And so the work requirement piece, just to remind people, this will limit people to just 3 months of SNAP within a 3-year period. So if you can't meet those work requirements, or if you're having problems getting enough hours, you will be kicked off of the SNAP program unless you can deal with that paperwork. And so a lot of our work will be helping people to meet the paperwork requirements. So it'll be a lot more work for client-facing organizations. It'll be a lot more work for families. It'll be a lot more work for the state agency. And again, this is one of those things that is effective as soon as we get guidance from USDA and the state. Switching gears to our immigrant neighbors, most immigrant families are not eligible and have never been eligible for SNAP, but there's been a very narrow group of immigrants that we've all agreed to make sure that they have access to the SNAP program. And those are asylees, refugees, victims of trafficking. They are now going to be barred from participating in SNAP. Once we have those details, it'll go into effect again. This is one of those more immediate things that we will see before the end of this year. The other piece is the freezing of the Thrifty Food Plan outside of inflation and adjustment. So that means moving forward, there will be no adjustment to the SNAP benefit, and everybody loses on this. So every few years, the USDA is required to assess the benefit and make sure that people are getting enough based on the science and information, and dietary requirements, what's available in the grocery store, what people are eating, and adjust the benefit. Just 2 years ago, the benefit was increased so that families would receive at the most $6, on average $6 per person. And that's up from what it had been for a long time, which was just at $4 per person. So now that freezes the benefit at that average of $6 per person amount. So that's a problem for all families who participate in the SNAP program. We can go to the next slide. All right, and we've mentioned some of these early on, and these are just a couple other things to keep in mind for the changes that we are seeing to the SNAP program. Recipients of LIHEAP, which is fuel assistance payments, will no longer automatically qualify households for the standard utility allowance. This is another simplification that helps to streamline the program and make sure that families have heat, but then it can also factor that into their benefits as well. That is no longer an automatic qualification. It also prohibits states from counting internet costs in the standard utility allowance as well. And these are all of the things that I've mentioned so far, the things that happen immediately, but we do not yet have a date for the actual implementation. So we will share that in the weeks and months to come. The things that are a little further down the road, but not too much further down the road, is the elimination of the SNAP Ed funding. And SNAP Education, again, was one of those programs that has been super helpful as far as educating families about addressing obesity issues and stretching SNAP benefits to go further and to eat healthier food. And we have in the past had millions of dollars come into the state for SNAP funding. That funding will be cut off. Many of our universities who operate these programs will have to stop operating these programs unless they can find private or funding from other sources. The government will no longer be helping to pay for SNAP Ed funding. That ends as of the end of this year. October 1st, 2025 is when that goes into effect. The next one that's a longer term that we've talked about as well, they passed the legislation on increasing state administrative costs. The state has always paid for 50% of the administrative costs to operate the SNAP program. That is now going to be bumped up to 75%. So the state will have to come up with additional money to pay for the administrative operations of the program, much more than they have before. And I'll get into a few more of those details on the next slide. And then finally, the major thing that has changed is the cost shift for the SNAP benefit. The federal government has always been responsible for paying for that benefit, and that's going to shift onto the state. Up to 15% of the cost of the benefit will be on the state to have to fund the payment, and so that goes into effect October 1st of 2027. And I have a few more details of just some of the numbers that are Tennessee specific on the next slide. The work requirement will reduce access to SNAP for many of the families that I listed earlier and have shared with you all. We anticipate up to 134,000 Tennesseans could potentially lose access to the program because of these paperwork, bureaucratic requirements that are now in place, that will now be in place. Immigrants in Tennessee who are here lawfully will lose food support as well. The cost shift is really something that we have our eyes on as far as how is the state going to afford to do this? If they do not have the money or the funds to do this, what does it mean for cutting people off the program if they aren't able to provide the money to pay for the benefits? And just to give you a sense of that cost to the state, we are looking at approximately $162 million that the state must come up with in benefit costs, and approximately $67.6 million in additional funding for the administrative costs. So this is a lot of money to have to come up with in the next couple of years. And this is a reoccurring cost. This isn't a one-time cost. This is something that we'll have to figure out how to fund every single year. So these are just some initial numbers that we have for you all, and a timeline that will come into clearer focus as we move forward. But we wanted to give you some of the information that's coming out now.
Thank you, Signe. I want to underscore your last statement. Everything is starting to come into focus slowly and surely. And so we will be here every week. If like last week, we did not have information to share because we were trying to synthesize just like the rest of the country. But we will be on camera, and if we don't, we will let you know. And so we are in this together. So thank you, Signe, for that. So now it's time for questions and answers. So we've had a lot of questions that have come in. Thank you. And thank you to Reed on our comms team for trying to synthesize those questions. I've gone through and identified some themes. And so if we don't read your question verbatim, know that we see it. All of these questions will help us as we do our research internally here at TJC with our national partners, and also they will serve as the baseline for our questions as we continue to engage our elected officials on the state level and in DC. So please send in your questions, and if you have information that would be helpful, please share that as well, the information in the chat so everyone can see that. So let's start with the first question. I think we are trying to understand and wrap our head around what will happen to pregnant women and children, both with respects to coverage for their care, for their prenatal care, what happens with delivery, what happens to the infants, and also for individuals that are residents, legal residents of Tennessee, and those that may identify or fall into the category as of undocumented. I'm going to turn to you, Jane, first, but then Signe, I'm also going to be on the heels with another question with regards to children and SNAP benefits. So Jane, I will turn it over to you. What happens to pregnant women and children?
So yeah, I think a lot of the questions are trying to understand whether there will be a change to coverage options for undocumented women who have children and are covered by CHIP, which you'll hear referred to as Cover Kids here in Tennessee. The answer is we don't know. So states have an option, which Tennessee has already opted into, to allow undocumented women to be covered just for the purpose of giving birth, because their children become citizens by virtue of being born on US soil. There's a lot in question about citizenship right now, and there might be changes to Tennessee's decision to even offer that coverage option. So that's one of the things that one of the questions that we can't quite answer, because we'll need guidance from the state as to how it plans to change in response to various federal laws that now, or federal changes that make citizenship a question, but also health insurance. For non-immigrant groups who are eligible for non-immigrants who are trying to be eligible for Medicaid. If you're pregnant, you are eligible for Medicaid. If you're a citizen and pregnant, you are eligible for Medicaid. So I think what we would be the most concerned about is the change in red tape and administrative processes that might make it harder for someone to get enrolled. But in terms of categorical eligibility, there's nothing changing so far.
All right, thank you, Jane. Signe, we have a question on children who receive low or no cost breakfast in school lunches. How has that been funded, and will we see important meals for these children in school go away? And school starts, at least here in Metro Nashville schools, school starts on August the 5th. So how do we understand the impact of the mega bill with regards to school breakfasts and lunches?
Yeah, so with the school meal program, it has an indirect impact in that families who start losing benefits, their SNAP benefits, they're no longer directly certified for free school meals. So we could start, as soon as this goes into effect, we could start to see a decrease in participation in school meals. Families fall off, or they have to find another way to access the school meal program. So we are likely to see hits to school meals. And I also saw a question about the Department of Ed cuts as well. I mean, that's new, and we'll be synthesizing that too. Our Department of Ed oversees school meals, and so there are likely to be additional threats to the school meal program because of all that. And so we will be monitoring that as well. But sadly, this bill has many ricocheting effects, and one of those is school meals.
So Signe, yesterday I was in a meeting with Metro Social Services, and there is a quote from one of their recent publications: "We can't food bank our way to the end of hunger. Virtually every church, every synagogue, every mosque in the country is trying to help people in need." Help us understand the safety net with regards to nutrition services in the state of Tennessee.
Yeah, no, that's an excellent thing to bring up. Some of our closest partners are the food banks, and their work works in tandem with the Nutrition Safety Net program. But they will tell you that for every one food bank meal, SNAP provides 9. And so if all of a sudden we are cutting thousands of families, hundreds of thousands of families, that means times 9, we have to find out how to feed these families. And the food banks themselves will tell you that they do not have the resources to do this. At the same time that the federal government is imposing these rules on the nutrition safety net programs, they are also limiting food banks resources as well. And so that makes this incredibly challenging, and this is a catastrophe that we are headed towards, and I think everybody's bracing themselves for this. So the advocacy is really important in making sure that we're lifting up what the consequences are with all that's happening right now.
Thank you, Sydney. Jane, well, before I come to you, Jane, let me remind the viewer audience, there are a lot of questions that we don't have the answers to. But again, these questions are helpful when it comes for our advocacy efforts, and also for where we start to research and how we categorize the responses as we receive them from our national partners and also from our community partners around the state. But please keep lifting up your questions because we need to understand what's top of mind from all of you all, our stakeholders on the call. So I just wanted to let you know that. And so, Jane, I'm not trying to blindside you, but I am going to lift up questions that we may or may not have all the answers to. But I do know, Jane, that you're pretty well versed in hospital closures here in the state of Tennessee. I'm wondering, particularly for those on the call that don't have that deep knowledge of hospital closures over the last 10 years or so in Tennessee, help us understand why our hospitals have closed, help us understand what's at stake, and then if you have any insight into maybe where we can leverage support to protect our hospitals, particularly in our rural areas.
Yeah, so I think starting with a look back over the last few years, it's a non-starter again because of the mechanisms this bill has used to impact Medicaid. But one of the best ways to fund hospitals, one of the proven revenue generators for hospitals was to expand Medicaid. So this would have meant more people qualify for Medicaid and Medicaid paying for more people's healthcare, which means hospitals getting paid for more people's healthcare. In the last 10 years since Tennessee chose not to expand Medicaid, we've had about 11 hospitals close. And research shows that from the Shep Center, which we can circulate after the call, shows that if states that expand Medicaid are 62% less likely to have hospitals close. So our state was already struggling to fund rural hospitals, and now this bill that's going to decrease the availability of healthcare for tens of thousands of people, hundreds of thousands of people in Tennessee is going to further impact the hospital's bottom line. In terms of what is at stake, the fact is healthcare in rural communities. So when rural hospitals are in danger of closing, they start to kind of chop the more complicated services. One of the first to go is obstetrics and gynecology, which is hard for women who are pregnant or need to give birth to get regular access to care. And then on top of that, the hospitals end up getting limited to basically emergency services, right? So a hospital that is only qualified to provide emergency services is not necessarily the one-stop shop you need for your primary care or from other for other kind of run-of-the-mill services. So you have folks already having to drive across counties, maybe outside of their own county, an hour, 2 hours away to get the care that they need. That's what's at stake, and that problem is that's a present issue right now in Tennessee, and it's only looking to get worse. So we're in a position to leverage the attention of our state legislators. Now that our federal representatives have acted, our state legislators have a responsibility to answer to how their districts, the rural hospitals in their districts, will survive. So there's $50 billion coming from the feds, which is going to be spread across all states. So how much of that is coming to Tennessee, we don't know. And at that point, right, I think the state will be making a decision as to how to use those funds effectively. So our leverage comes now in holding the state accountable.
Jane, a follow-up question. This morning when I was driving in, I heard I heard that Senator Josh Hawley might be introducing legislation with regards to provider taxes. Right now, they're set to go into play, I believe, in 2030, but he wants to prevent provider taxes all along across the board, right? And he also said that this is going to be critical with regards to hospitals, rural hospital closures in Tennessee, I mean, in the country. So could you sort of help us understand the nuance with that?
Yeah, so provider taxes, when people are talking about provider taxes with Medicaid, they're talking about how states are able to tax the hospitals and other healthcare providers in that state and use the money they collect from those taxes to pay for the Medicaid program. So we've talked about this before. Medicaid is part federal, part state. So for the state to pay for the Medicaid bills, they're actually taxing providers. If the state can't tax providers, which is the challenge of this bill, it makes it harder for states to tax providers, then the state can't pay for Medicaid. And again, that's another burden, another hole in the state budget that needs to be filled with money from somewhere. So what the most recent announcement from Hawley is that he's trying to repeal the portion of the federal law that just passed so that states can actually tax providers freely and use that money to pay for Medicaid. It's almost a realization that if you remove provider taxes as an option, you're making it harder for states to fund their Medicaid program, and you're making it challenging for states for individuals to have access to healthcare. So this is kind of walking that back, and that affects rural hospitals, it affects metro hospitals, it affects everyone. So that's kind of the nuance there with provider taxes. They've already made it harder. The bill has already made it harder to actually tax providers. And now we're kind of walk that back because there's a recognition that that's a dangerous kind of landscape for the healthcare system.
Thanks, thanks, Jane. Signe, talk to us about the correlation between SNAP cuts and the proposed $7 billion cuts to the Department of Education. And I think you're on mute, Signe.
All right, now I think I'm off mute. Yes, so I had tried to allude to that earlier. I think some of the issues with the Department of Education that we're hearing about just in recent days will have implications for the school meal program. So we are watching that closely. Our Department of Ed oversees the National School Lunch Program, and so there are likely to be repercussions because of these proposed cuts to the Department of Ed. So in addition to what just happened with the bill, the reconciliation bill, we'll be watching to see what's happening with school meals as well.
Thank you. All right, let me see what we have. I was having trouble with my camera, everyone. But I'm back on track. So back still with you, Signe, and potentially Jane, with regards to the work requirements, does volunteer work count for that? Can you help us understand that?
Yes, yeah, volunteer work does count for that. But again, it really comes down to the paperwork piece and trying to track down the person that needs to sign off on it and getting that information to the state. So even people who are working or volunteering or doing what they're supposed to do often run into problems because they can't capture exactly what it is what the state is asking for. So that's where we see people falling off the program, or they experience such a burden that they decide, I'm not even going to bother because it takes so much work and effort in order for me to get these benefits. I'm not even going to try. And so one of our big fears is with all of this passing is we're going to start to miss people who don't even have the time or the capacity to navigate this huge paperwork requirement that is now going to befall them.
Yeah. Thank you. Jane, is there anything you want to add to that? No.
No, the landscape is the same on the Medicaid side, but I just wanted to clarify, for Medicaid, the work requirement provisions in the federal bill apply to states that have expanded Medicaid. Tennessee has not expanded Medicaid, so there aren't explicit work requirements that our state population is facing. The threat here regarding work requirements is that Tennessee legislators, so at the state level, have tried to implement work requirements in the past. So there's a concern that if they see the green light from the feds, there might be an encouragement to reestablish state level work requirements. We have not seen that happen yet. That is what we're concerned about, and we'll keep watching.
Okay. Jane, staying with you, this question is about Katie Beckett. For those that aren't familiar with Katie Beckett, quickly, high level, what is Katie Beckett? And then what is the impact to the Katie Beckett waiver program based on what we know with the mega bill right now?
So based on what we know right now, there are no direct impacts on the Katie Beckett program. I was saying earlier, one of the portions of the bill is that it expands who or how states can approach establishing waivers. So 1915C waivers are for people with disabilities, and which can include Katie Beckett. And it's essentially saying that you don't need this extremely high level of care. States, you don't need to prove an extremely high level of care to receive services under the waiver, but the state can't just expand who receives waiver services because they don't want to increase the wait times for people who are already receiving waiver services. So it opens a door, but then limits how much that door will be open. And it's back to the states kind of do this balancing act of, do we want to provide services to more people, and can we do that without making it a challenge for people who are already receiving services, these HCBS services, without making it harder for them to receive their care. So we don't know if anything is going to change, because if everything has to end up being balanced, maybe there won't be an expansion of HCBS services, or maybe there will be, but they'll look different than what we're expecting. So nothing predicted specifically for Katie Beckett at the moment, but again, the ball is in the state's court, so that the program could look really, really different in the next, who knows how.
Thank you. Signy, we haven't talked about college students. We have a question about the impact of SNAP with college students in work-study programs.
Yeah, so same, like, college students actually have surprisingly stricter requirements, and it hasn't really changed so much under this, other than if a college student has a 14-year-old, they have to adhere to this. Same problems arise. They'll have to meet these work requirements, and work study often doesn't count, which is kind of baffling. I mean, they're all they do is work and study, and that's an important part of what they're doing. And so SNAP should be available to students in that way. So sadly, the work requirements will hit students as well.
Yeah, and that's real. I mean, because the jobs on college campuses, they are real jobs. It just sometimes a student can apply for them, right? And they can work to offset the cost of tuition. That's a whole nother conversation about college tuition. But we'll talk about that in another time. But let's think sort of tactically about the resources that the state has. And this question is for both you, I think impacts the health and the nutrition side. Do the states have the infrastructure to accommodate the work requirement process? And if not, what do you know about that? Just help me understand what you all know about the infrastructure needed and whether or not Tennessee is prepared.
I can start. I mean, it's going to take a lot of staff power in order to do this. And for those of you who were with us in the past couple of years, with the state going through the new legacy, getting rid of their legacy system and onboarding a new technology, they were struggling with staff cuts, and it made it that much worse for the families that were trying to access SNAP. And so we're envisioning something similar with this. It's not just that we have clients that are going to try to get through this, and Tennesseans who are going to try to apply and get through this process, but it's unclear that the staff will have that DHS, the state agency, will have the staff in order to be able to meet the need and all of the requirements that they have to do in order to approve an application now. And on top of that, which I can go into if we have a few minutes later, there's also the error rate factor. So states are going to be even more vigilant about their error rate, because if they're not meeting, if they're not keeping their error rate low, it will impact the cost to the state, the cost that the state must pay for the benefit. So that's a whole other piece to this that I think isn't really being factored in. And all of us have heard about the staff being cut at the USDA level, at the national level, and also freezes to staff at the state level too. That works in contrast and in contradiction to what's being done here. They need to staff up if they're going to be doing any of these rules and putting this into play. They need staff in order to make this work.
Thank you. Go ahead, Jane.
On the Medicaid side, it's very similar, but actually there hasn't been a history of implementing work requirements with the Medicaid program. So this is new. This is a new structure at the state level, at the federal level, however you want to slice and dice it. There were two examples recently. I'll focus on Georgia. Georgia implemented work requirements for the expansion population, just like what's being proposed in the bill. And according to its own budget, the state's own budget releases and additional research into the implementation of the program, they sunk upwards of $20 million, and they were only able to get a couple thousand people enrolled. I mean, work requirements are such a massive administrative burden on either Medicaid or SNAP, or really any program. And the payoffs are just so little. There's so much proof that work requirements don't work. When you hear that, when you hear people say that, this is what they're talking about. It's making it harder for people to even to open the door into enrolling in the program, and then there really isn't any payoff. So we have a lot of examples that we have examples from two states, from Georgia and from Arkansas, that work requirements are expensive and they don't actually bring people onto the program. So it begs the question, if it's kicking people off, why are we doing it? So that's what I just wanted to add that on the Medicaid.
Thanks. So my final two questions for our conversation today. We know that about $9 million, there's a $9 billion increase cost share for Medicaid. Where's Tennessee going to get this money? I have an idea because, right, and because education is also a huge line item in our budget. But Jane, what do you know about the trade-off for the funding cuts for Medicaid and how Tennessee might navigate that landscape?
So this is where I'm not in a position to speculate. I just wanted to add one caveat. So the $9 billion estimated increases over the next 10 years, which is kind of a lot of the provisions of the bill are expected to hit over a period of 10 years. So each year, the amount the state needs to cover is going to look different. It could be higher one year, lower another. And that's why it's hard to say where the money will come from. Maybe one year it comes from one program in the state's budget, out of the state's budget, and another year it comes from somewhere else. We don't know. I'm hesitant to even start to think about what might be more or less at risk. I want all these services that are critical to be funded. I don't want anything to be sacrificed for Medicaid. So I really can't say, but I do think that folks, as we again have conversations with our state legislators, we want to make sure they understand that we know the trade-offs that they've been put in a position to make, and we want to be aware of how they approach those decisions. So even though we can't say, we can at least have some awareness.
Yeah. So the last question is, what can be done collectively to communicate the reality of the impact of the federal cuts to our elected national and state leaders and representatives. We have also seen the communications from Senator Blackburn and Representative Ogle's office. In fact, the Tennessee Justice Center is actively working with our comms team to correct or counteract that mis and disinformation with the facts. And we know that if we stick to the facts are nonpartisan, the facts are about numbers and about people. And so we will be sharing those messages out. In preparation for today's call, we received information just as late as yesterday at around 6 o'clock. And so we're busy translating that into a format that is going to be usable for everyone on the call and everyone across the state. But again, we do have to counteract that mis and disinformation for both Medicaid and SNAP. When you do have that information, of course, we're going to share it with our networks, our personal networks, our professional networks, our social networks, but we're also going to stay engaged with our elected officials. So here's the call to action. It makes a big difference when you tell your elected official that I am a registered voter in your district. And so we are encouraging everyone to register to vote. We are encouraging everyone to spread in their networks to encourage people to understand the landscape of issues that impact them in their lives and their communities. Be informed voters. That's really helpful when we engage and go into conversations or either email or call our elected officials, both in DC and here in Nashville, and in our respective districts, right? So it's really important to register to vote. Make sure your voter registration is up to date. Inform yourself of the issues, and then continue to engage our elected officials. Tell your story. Say that you don't approve of the mega bill and tell them why. The same questions that we're talking about on the call today are the same questions we need to be lifting up to their legislators. Sometimes they might look a different way, but sometimes they really just don't understand the nuances. So I choose to stay positive and to continue to hold their feet to the fire. And that's the call to action. Engage our elected officials, collect stories. The stories don't have to be perfect, but if you can connect a lived experience with a policy implication and the impact in your own words, that's what we need. We have a link here, I think, right there. Thank you, Reed. You can drop your stories in the chat. Again, that helps us understand how to message and how to frame, and we can then share those communication materials back with you. You can call, you can go to the website, you can call 615-241-9563, or just send an email. It doesn't have a quick and dirty email to stories@tnjustice.org. I want to thank all of you all for being on the call today. Thank you for staying engaged. We cannot do this without you. We are all in this together. Sydney, Jane, thank you. You are our resident experts. And if you have any questions, please continue to reach out. If we cannot answer right away, give us time. We'll do the best that we can. But we are working every day to synthesize and the information and understanding and digest it and send it out to you all so you all can understand it. Thank you, and please enjoy the rest of your week. Stay positive, register to vote, and contact your elected official. Have a good one, everyone.